satisfactory customer service for all of the people applying for Obamacare. And since some elderly people haven't qualified, it's because of state decisions. There are some states that haven't expanded into like Medicaid, Medicare, and also and Obamacare. And it's their decision on like what aspects they cover of Obamacare. And so that's not really Obamacare's fault. It's mainly just a state system. Remember that blanket you had that you used to protect yourself from that monster that is hiding under your bed? That blanket was, and maybe still is, that your source of protection. For those Americans that are insured with Medicaid and Medicare, two insurance programs run by Obamacare, their blanket are those groups. These programs can give them a sense of security that they lack. While the people are literally covered by these programs, it also lets them know that they are protected by this insurance. Medicaid and Medicare are available to give the proper aid and care to those Americans in need. At least 45 million Americans are considered to be in the low-income category, and that number still continues to rise today. This means that these people don't earn enough money to buy basic necessities such as food and clothing. In the next decade, Obamacare can help insure many of those Americans using a federal and state-run program called Medicaid. Medicaid helps low-income families and individuals that pay for medical care. And
yes. So you said that Medicaid helps individuals pay for Medicare, but actually get medical insurance that people who are fully insured would receive the same way. But actually, doctors are not available for Medicaid. Oftentimes they don't accept Medicaid. Customers, because it restricts tests and treatments and pays poorly, leading the Medicaid patients to be turned to using emergency rooms, and the emergency rooms then overflow with people who don't need the emergency care at that time and instead just need a checkup, which is denied by doctors.
It's the doctor's decision if they want to use Medicaid, and also with Medicaid, it brings funding into the state that like funds hospitals and doctors' offices. Medicaid has helped low-income families and individuals to pay for medical care to cover about 70 million Americans as of December 2014. About 19 million of those Americans were adults, 16 million elderly people, and 33 million children. Medicaid continues to expand across the country to ensure that all Americans will soon be covered by this insurance. But while the goal of Obamacare is to allow all Americans the ability to be covered by insurance, some states haven't expanded to Medicaid yet. This results in about 7 million Americans to stay uninsured. So for those people who were or are not covered by Medicaid, there's a possibility it was or is due to the fact that this program hasn't expanded to their state yet. For those states, they're not only leaving people uninsured, but they're losing money. Expanding Medicaid allows more federal. Expanding Medicaid also allows more federal funding towards the state, towards hospitals, other facilities. While not expanding, it can lead to a decrease of economic activity in the state. Currently, about 29 states are expanding to Medicaid in 2015. To reach the goal to insure all Americans, the remaining states need to expand it to Medicaid too, not only for the people, for the state itself. Along with Medicaid, Obamacare also offers Medicare. This federal health insurance program is for people 65 years or older, and also including some younger people with disabilities. Medicare comes with 4 parts that all cover various medical aspects. Medicare is a valuable social program in the United States that covers about 49 million Americans. That number is projected to rise to 76 million in 2030. Combined, Medicaid and Medicare can cover about 119 million Americans in the future, and that number will continue to grow. No thanks. Medicaid and Medicare are necessary programs that can save lives and can ensure coverage for many Americans.
Time.